Sure. Technical assistance is key to making many of these real estate development projects happen, especially for childcare providers. So particularly with the Fund for Quality model, we see technical assistance as being comprehensive and consisting of three main parts. First, there's the guided organizational planning, which we partner with Public Health Management Corporation, who is an anchor in early childhood quality programming. And they are able to work with providers individually so that they're able to access business supports to strengthen their business plans, understand operational models on how to braid and blend different funding sources to make their revenue work post-expansion. Services to assist with marketing and planning for serving new children, and what does that ramp up period look like as they're looking to grow sustainably, and also the staffing model, which is intrinsic to EC in general, but especially as you're pursuing high quality operations and understanding what does it look like? What kind of staff do I need to recruit? And how will I sustain staff at this level? And how will I do that without being paid for a certain period of time before I reach my quality level where I can receive higher reimbursements? So it's a lot of math and planning going on. In addition to that, there's the guided project planning that needs to occur. Childcare facilities and the environment that young children are in is extremely important and complicated. And the project development involves having architects who understand childcare, understands what the child and staff ratios are, and how to maximize the use of space while not jeopardizing quality for the children. Having childcare licensing consultants who can guide providers through the very complicated childcare licensing system, zoning requirements, regulatory requirements for buildings, and also monitoring the project as it's underway and troubleshooting those inevitable issues that comes up when you're embarking on these huge construction projects, and doing all that so that providers are still able to focus on what they need to do to ensure the learning and development and safety of children. And thirdly would be the tools and resources that providers are able to meet funding requirements and be in compliance so that they can be good stewards of whether it's grant funds or good borrowers.
Dan,